Hi everyone, it's Anita again, coming to you here with an update on some education on diabetes. Today I want to talk about diabetes. Today you can have type 1 or you can have type 2 diabetes. Type 1 and type 2 diabetes. Type 1 is basically your body is unable to produce insulin in your islets of Langerhans in your pancreas. Type 2 diabetes can be um, your producing some sort of insulin, but you're not producing enough. Now, with type 1 diabetes, um, as I said, you don't produce any insulin, but type 2, you produce some. Okay? The doctors will manage you accordingly. But before they can manage you properly, they have to determine what type of diabetes you have. If you have type 1 diabetes or type 2, they need to do an HbA1c test. And that test will be an average over 3 to 6 months. And it will tell you your level or your percentage of insulin in your body, or they will do a functional test to check to see if your body is producing any sort of insulin. Now, I just want you to understand what happens when you eat. You eat carbohydrate, you eat sugar, your body triggers, it tells your islet that we need to have some insulin to get rid of the carbohydrates that we need to change into glucose to be absorbed in the body. And if this is not being absorbed, then your body will have too much of sugar, which we call glucose in your body. Okay? What happens? Also, you don't have synthesis of proteins. You have an increase in nitrogen in your body and protein waste taking place. Then your body or your organs is not being fed, your cells is not being fed properly. Okay, diabetes ketosis is what can happen when you have an increased amount of the sugar in your body. You have free fat, you do not oxidize these fats, and your body have an increase of glucose due to dehydration as well. So when someone can become ketotic, sometimes you notice that that person's breath has a sort of foulish smell, um, and you can identify it by that as well. Um, in order for a doctor to determine whether you're confirmed diabetic, as I said, HbA1c test. Also, some doctors will do a test in your urine to check to see if there's any glucose and how much glucose, whether it's plus in your urine, to determine if your body is just getting rid of the glucose or the sugar in the blood. Okay, there are some complications of diabetes. There's cardiovascular disease. That's because of the free fat that is floating around. It will be in your blood, in your system, then it can get, make cholesterol in your body, deposit in your veins, causing cholesterol, causing an increase in the pressure and in the flow in your blood. You could have neurological damages, especially in your feet. People who have diabetes get damage, their feet has no sensation. They can knock it on places and damage it, and it can be lead. Also, you can get sores and because of these things. So you have to be very cautious with your feet. You can also have kidney damages because of high blood pressure. That comes along with diabetes, also because of the high molecules of sugar that is going through the kidney as well, and due to infections, because diabetic people are always prone to having bladder or kidney infections. Another thing that you have to be cautious of, you can have damages to your eyes. People who are diabetic can have diabetic retinopathies. People who are diabetics can have gradual loss of their vision. They can end up blind. Also, as I said, you can damage your foot. Skin conditions, because your glucose is high, you get itchy skin, you scratch your skin, you damage your skin, then you get infected. So you can have abscesses and you can have sores on your skin, and rashes. People with diabetic can also be end up having Alzheimer's and sometimes depression, especially when your diabetes is not being controlled. You feel very unwell, you don't want to get up, you feel tired and sick. Some of the symptoms of diabetes is extreme weakness and tiredness. As I said, some of these things can lead to depression. You could get very thirsty. You find that you're waking up at night, going to the toilet regularly. You have bottles of water at the side of your bed, drinking water constantly. You're saying you're thirsty. That can be a sign. Increased urination, abdominal pain. You could have nausea and vomiting after you eat or drink. You still feel sick. It can be a sign. So, especially blurry revisions. Wound is not healing very well. You have irritations and you become moody. Change in your menstrual cycle. Other signs of diabetes are things like waist loss, rapid heartbeat, reducing blood pressures, low temperature, extreme hunger. As I said, extreme hunger, extreme thirst, um, the presence of ketones in your urine, your fatigue, and as I said, irritable. Diagnosis, as I said, random blood test, HbA1c test to be done by your doctors to check, and this will give you an average. Type 2 diabetes, the same HbA1c test, and they can check your tolerance as well. What trigger diabetes? Infections can trigger diabetes. You can be what you call when you become pregnant. Women, when you become pregnant, you can have an onset of gestational diabetes, insulin, um, juvenile diabetes when you don't have any form of insulin as your child growing up. You can have it between your teenage years, and then adult type 1 diabetes, no production of insulin. Type 2, you're producing some. Of the doctors may give you some tablets for type 2, or it might be diet control. For type 1, it might be insulin control. Just want to tell you that, as I said, infection triggers diabetes because of the autoimmune effect. When your body start producing antibodies, those antibodies can now fight against your own body system, causing you to be diabetic. So as I said, some of the risk factors of diabetes, it can be genetics, it can be viral illnesses, it can be a race because of your ethnic background, your geographical location, poorer countries, family history, poor diet, and poor exercise, and autoimmune condition such as HLA complex, HLA complex. Okay, I want you to understand those are some technical terms that we would use in the medical field, but for people that would see that needs to understand the basic things, I'm doing this for you to understand. Okay, and as I said, diagnosis of diabetes is very important. Some people I have met, they've been told that they're diabetic, but they haven't had a blood test to check to see what type of diabetes you have. They haven't done a blood test to check their heart, their kidney, and their liver function. Those are very important things that you need to do. You haven't had a urine analysis to see if there's any proteins or blood in your urine. You haven't checked to see if there's any infections, etc. in your bladder or in your kidney. Those things are very important. So I want to suggest to people, anyone, if you've been told that you are diabetic and you're not living in, let's say you're living in Africa, or in the Caribbean, or in England, or wherever you are living, you would find that the doctors will have to say, oh, I would need to do a test to just double check to see what type of diabetes you have, if you're producing insulin, etc., etc. It needs to be done. So you need to request it. Fasting glucose is important to check the level of your tolerance. Oral tolerance, for some people they do, but it's still regarding taking bloods. Okay, so it's important for you to have some blood tests. Okay, type 2 diabetes is more common than type 1, but type 2 can lead to type 1 if you don't manage your diabetes very well. And as I said, the difference between type 1 and type 2 diabetes: type 1, you have no insulin production. Type 2, you have some insulin production. So you may be managed by a diet, or you may be managed by tablets, but you have to follow the instructions that you have been given, and you need to educate yourself regarding your diabetes. Infections risk: people who are infection in this COVID-19 season, where there is infections and they're saying to you to stay home. It's very important for you to stay at home, because if you become infected with any sort of viral illness, bacterial infections, it increases your glucose. If you have a fever, you lose fluids via your skin, you become dehydrated, your concentration of glucose become high, you become hyperglycemic, which means an increase in your blood glucose, and then you can have diabetic coma. You can also because you're also high glucose, you do not absorb your food very well, because your blood nitrogen and your blood protein level, it's not being absorbed properly. Your nutrition in your body, it's not being absorbed properly because of your high glucose in your blood. So diabetic people, because of type 1 being an immune disease as well, it's been the body attacks its own self. When you become infectious with a virus, that virus will also increase the risk of your body fighting against itself. So type 1 and type 2 people, those of you who are diabetic, you need to stay at home as the government says, and you need to follow the rules. Stay nourished, take your vitamins, take your supplements, and stay at home. In order to prevent infections, you got to have good urinary hygiene. Women, you need to wash and clean yourself. Men, you need to do the same. Any symptoms of raised temperature, change in your blood glucose, any smelly or foul discharge, cloudy urine, painful or swelling in your body, any change in your bowel habits, warm to touch, any sort of fever, you need to present yourself to your doctor and tell them, so you can have some sort of antibiotics to help you to fight against whatever infections that it is going on in there. Usually, I want to say something, you are prone to urinary infections, so you have to be very careful. Monitor your glucose every day, and if you find that there's a sudden spike in your glucose, people, I want to encourage you to get your urinary test done, and make sure you get a blood test done to see if you've got any infection, and especially check your temperature to see if you have a temperature. That will be the cardinal sign to tell you whether or not you have an infection, yes or no. Okay, so it's very important for you to diagnose your any infection, and then it's important for them to identify which bacteria, which microorganisms is causing it, so they will give you the appropriate medication. I just want to say that some patients that I've interviewed, I've triaged them through the phone, and I was able to identify that they did have an infection, and they were able to get a broad spectrum antibiotics. Make sure you tell your GP or your doctors whether or not you're allergic to any medication, so they don't give you any antibiotics that you are allergic to. It's very, very important for you to do that. So once you're taking your antibiotics for your infection, that means you are starting to attack and correct the microorganisms that is making you feel unwell, and it will start to reduce your glucose in your blood too as well. So you got to take your medication and have your diet and exercise, which I'll talk about later on. Okay. I just want you to understand that it's very important for a diabetic person to take care of their feet. As I said to you, some of the risk factor of a diabetic person is that you will lose sensation in your feet, and your feet, you will walk with it and go all over, knock it about and not know you knock it. I just want to say that my dad, when he was younger, it happened to him. He knocked his feet. He didn't even realize he's ended up having a surgery on that foot. So I just want to tell you something. Be very vigilant on do not walk bare feet. Make sure you have a slippers on. Make sure you have a shoes on. Do not walk bare feet, and do not go anywhere bare feet, because you can damage your foot. Anything, let's say if a bottle get into a place that is numb, you would not know the bottle is dead, and it will create an infectious area there, and then you will end up going to the hospital, and you don't even know what's going on. You will see redness, swelling, and pain, and next thing you see, you've lost your leg because you've missed something. I just want to say to you that people with diabetes are at risk for losing limbs because of diabetes. I've seen a lot of patients have operation because they've lost their limbs. So I want to tell you something. The most important thing for you right now is to manage your diabetes. And to manage your diabetes is one, you should have your medication and take your medication as prescribed. Let me tell you something. If the medication is making you feel unwell, you please inform your doctors that you're not feeling well with the medication that you've given, and they will be able to change your medication and give you something else. There are medications that will make you, one, there are different types of insulin. There's long lasting, short lasting. There are insulin. So you have to make sure that they're giving you the right type of insulin, okay, for your body, and you take it according to the instructions that they give to you. Now, they may give you some tablets that will cause you to pass the glucose out in your urine. So it is very important for you to understand that type of tablets that they give to you, that particular tablet can also put you at risk for masking any virus, especially corona and any infection that is happening. It will mask the infection, so you could never tell whether or not you have it, yes or no. So you have got to ask your doctors, what tablets are you giving me? Is this tablet okay? Because I don't want it to mask the infection and it's not being identified. Okay, so please remember that you need to speak to your doctor about your medication and what medication he's giving you. Patients who are type 2, they can either have something like gliptin and metformin, and those things will help you to increase the production of insulin in your system. So when you take the septagliptin or the gliptins and the metformin, some doctors will give you glycoside as well. That will help you. So one is short lasting, one is long lasting. It's just like insulin. There's one short lasting and one long lasting. So you've got to educate yourself as to what type of insulin you have. If you don't know and you're not sure, ask your doctor. And if you're not getting anywhere, you can always inbox me, or you can always add me on your WhatsApp 0741285797. You can always add me onto your WhatsApp, and I can always text you and give you some advice. So the thing is, you always have to get advice from someone who is qualified to do so. Don't just go and let someone tell you to do this and do that, and it's not good. Trust me, I have access to both the medical and the non-medical treatment that people use and what they use for different type of things. But the most important thing for you to understand is to take your medication. You can reverse type 2 diabetes. I can tell you something. If you manage it very well and you lose the weight, you can reverse it. Type 1 diabetes, I haven't heard, but they're saying that now people can reverse from the old type of diabetes. I haven't seen the statistics, so I would not confirm everything now, but you can always inbox me. I will check the statistics for you. Management of infection, it is important for you to have your medication and to get rid of your infection. If you're not sure, you can inbox me and call me. Now, another thing you have to do is your diet. I'm going to show you a picture here, if you can see it, on the equal portions of diet. So you see you have meat as quarter, carbohydrates quarter, and then you have full vegetables. Then you have some fruits there, you can have some milk. And it is very important for you to proportionate your food properly. Okay, so you can have half plate of vegetables, then you have quarter plate of protein, quarter plate of carbohydrates. And when I mean a standard plate, don't take a humongous plate and then you say, oh, Anita, you told me I can have a plate, so you took a big plate so you can have a big portion. No, it's a standard eating plate, and you just have enough. Okay, you don't go and eat and eat. You're just eating enough to have your nutrition, have a well-balanced diet. Some books that help me even now to have a diet, I use this book. It's a very low-calorie diet, and you have, each meal can give you to 200 to 375% calories, and it's very good. You get meat, you get vegetables, you cook it very, very healthy food, so you don't really miss out on anything. Okay, So I find this is very good. Another book I find that was very good was this Alkaline Diet. It gives me all of the blends that I can have. Listen, I'm not advertising for anyone. I'm just telling you what is working and what I like. I like these very well because they give me a lot of smoothies that I can use and healthy way of cooking. For those of you who love to be with the crowd, I find that Slimming World was really nice. So they're really good, and you can have, I go through their books. They give you books and you can help yourself. You lose weight gradually but surely. So you're not starving yourself. They give teaching you how to make your meal. So you can find little books that can help you. Another thing that you need to do as a diabetic is exercise. I suggest you 3 times a week, you start for 20 minutes, you walk, take a little walk. Then you go another 3 times a week, 20 minutes walk. Then you do 4 times a week, 30 minutes walk, 5 times. So you increase gradually. If you want to run, you feel you're able to run, that's fine. For people who have a big tummy and the tummy seems to be getting out of control, you can sit down and you can use some elastic bands that can help you to exercise. And very soon we will be establishing a little wellness exercise routine for people, and we will be putting it out there. You can learn once, you can do it on home by yourself, or if you want to have a group, we will probably be able to facilitate that as well. I just want to encourage you to continually monitor your glucose daily, okay? And I just want to say that each diabetic person, someone, once you've been diagnosed as diabetic, you should be monitoring your glucose every day and your food intake every day, and it will tell you how you're doing. You need to be doing very well. So I just want to suggest to get a machine like this that has the stick, the pen, and everything that you need, and a little book. So you record it every day. So every day you can check. Okay, this I have one of this machine here. So as you can see, it's there because, and another thing you need to have is wipes. You need to have some sort of wipes. Okay, they call it pre-injection wipes to be able to do your checks properly. I just want to say that if you don't do your checks properly, it means that you're putting yourself at risk, okay, because you don't have an idea of what is going on. And as I said to you, your doctors will give you insulin, and some are rapid, short lasting, some are intermediate, long term. The doctors will give you tablets that are gliptins. They will give you tablets that will help you to get rid of some of the glucose in your system. I just want to do a quick test. I just want to show you, because some people don't know how to use this, and I just want to give you a quick before I go. Now this is a stick. If you see, it's very tiny. The stick is very tiny. This section of the stick goes into the machine, and this section of the stick is where you put the blood. Okay, now some people have different types of pen. This is one pen that I know. Okay, and some people do not know how to load the in. So this is the thing, and they come with a needle. All right, you put the needle in, okay, and then you take the cap off. All right, then you put this one on. Okay, this is personal. If it's individual, okay, you change the needle regularly. Okay, you don't lend anyone your machine. Okay, it should be a personal machine, because someone can use a machine and leave the needle in, and you can go and stick yourself with it, and you don't know if that person is carrying any other disease. Now this is a machine that you should have. Okay, the machine has 3 adjustable thing, and as I said, your glucose can either be in millimole, okay, like this. So your glucose could be, as I said, if you can see it there, different levels. So one can be mg/dl and one could be millimole. So for this machine, it is set on millimole. Okay. All right. So if you need to do this, I would suggest that you take out, make sure you wash your hands, and then you take out this wipe. My hands is clean. This is alcohol based wipe. Okay. It's a one use. You have this machine. Some machine have a something to turn to engage it, but this one has a pull down. So if you hear it goes off, and if you pull it, it engage. So it goes off and it engages when you pull it up. Okay. So what I say to some patients, especially when they don't understand how to use the machine, I say to them, set it on 3 as a minimum, okay? Because 1, 2, 3, and it goes up all the way up to 8. So that's the thickness per individual hand. So I set it basically on 3. So if you set it on 3, it will be able to get there. Then you clean your hands very well. God help me, I'm doing it on myself. You clean your hands very well, okay? You allow this to dry. So while this is drying, you can take your machine, and as I said, the tip where the stripe is, it goes into the machine. So you put that in the machine. If you see, the machine will come on and it will tell you drop. Hopefully you're seeing it. It's seeing a drop there. So then it says a drop. So you quickly now engage your thing, stick your hand. Sorry, it's a bit gory. Then you squeeze it, and on the tip, you put the tip of it here. Yeah? And then you wait for the reading. It will start showing you a line reading there. So you see, mine is 6.4. Okay? So I've got a 6.4 reading. So your reading, especially a diabetic, do not allow your reading to go above 8. Okay? If you start to go above 8, you're between 7 and 8, you're in an amber zone, and you should be between 6 and 7, not 7 and 8. So you're amber if you go in between 7 and 8. If you go above 8, it is red. It means that you either need to, not doing something that is right. Okay, maybe you've had something sweet, you're not taking your medication as prescribed. Okay, so you got to remember that it's really important for you to monitor it, and you need to write it down so your GP can know, or your doctor can know whether or not it is working properly. Okay, I'm sorry that I had to give a gory detail like that. All your needles and all your things should be going in a sharps bin. Okay, put it in a bin and then take it to the GP office or the doctor office or somewhere where they can dispose of it properly. Okay, I just want you to understand that your machine is very important. Usually it has a little bottle that will test your machine every day, and at the back of it has a battery section. Okay, a back of the machine has batteries as well, so you may need to change those batteries if it's not working properly. I suggest to you that you get some more training. If you get a machine, you get some more training, or the person who you're buying it trains you on how to do it. Now I want to say to you that you can get machines in any pharmacy, but if the machines are expensive, you can also contact me, and you can inbox me, and I can also try and source you something cheap. It depends on where you're living in the world, and if there is any local area where I know, or anyone I know that can get you some cheap machines. No, the machines, not because it's cheap, it doesn't mean to say it's not good. Okay, the most important thing with the machine is the batteries and the stick. If you don't have sticks, you don't have batteries, it doesn't work. So whatever you're buying, you must have a regular supply of it. Okay, and as I said, it is important for you to see your GP and your doctor regularly, and to have checks on your diabetes. And a specific thing I want to say to people in this COVID-19 season, where COVID-19 is very, very dangerous. It attacks the respiratory system. But I want to let you know, your fever, high blood pressure, increased glucose in your blood, it will happen when you come in contact with a virus. Once you have a viral illness, that's what happens. Your blood glucose and your blood pressure will also go up. So I want to encourage you, and I want to encourage someone, if this is helpful to you, you can share it. Share it to somebody, give somebody, let them look at it, and tell them if they need more answers or questions, you can always inbox me, or you can also put me on your WhatsApp if you have WhatsApp. So you can put me as +44 741 285 7197. My name is Anita. I am an advanced nurse practitioner, and I work with patients, and I regularly assess patients and usually give advice over the phone as well. So if you need any advice, you can always speak to me. And if you need any advice on where you can get a machine, you can also speak to me, and I would try and let you know where you can get machines. Okay? Again, I want to encourage you all, make sure you take care of yourselves, look after your feet, eat your balanced diet, take your medication, exercise, and do your blood glucose, check your blood pressure daily, and keep a record of it, so when you go to visit your doctors, you can let them know. And I just want you to know, again, my name is Anita. If you need any advice, you can also speak to me. I have colleagues all over the world, and I have colleagues in the Caribbean, I have colleagues in the UK, I have colleagues in the US, and they're very high and qualified people. I just want to thank you very much. If this video has been a good information, you can like and share. My target population is for people who do not understand the basic concepts, because I'm doing this at the back of the fact that my sister-in-law as well, I love her to bits, that I needed to teach her on using the machines and regularly checking, and she's doing it regularly, and I am really grateful, and she's doing pretty well, pretty well, and I'm thankful for that. So as I said, the books that I've shown you is what I use for myself. I'm not advertising for any company. I'm not being paid by anyone for doing this. I am doing this because I love the job that I do, and I thank you very much. Like and share, and you can also subscribe, so the next time I have any training going on, you can be a part of it. Okay, bye, and you take care. Next time we will chat again. Next time I'm coming on, I will talk about a bit more about blood pressure and how you can prevent and reduce your blood pressures as well. Okay, bye, and you take care.